Time to act. One pill can be the difference between life and death. The warning for parents and teachers as children head back to school. Good morning. It's August 8th, and I'm Jill Chadwick in for Jessica Lovell. Welcome to the Morning Medical Update. And thanks for joining us on Facebook, YouTube, and Twitter. Our medical experts today are coming to you from the Dolph C. Simons Jr. Family Broadcast Studio. Doesn't it seem like everyone you know is getting sick? It's not your imagination. We can attest to that. We've even had people here that have been missing work due to COVID. COVID cases are going up across the metro. Dr. Dana Hawkinson joins us with the count, which I hope is holding steady. We'll find out. Plus, kids are gearing up to get back to the classroom, and as they do, we want to talk about the danger of a specific drug that is circulating. Our experts this morning include Medical Director of the University of Kansas Health System Marillac Campus, Dr. Mitchell Douglas, welcome. Psychiatrist and Medical Director of our Addiction Clinic, Dr. Rupa Sethi, sitting here in the middle. Good morning.
Good morning.
And Sergeant Jake Bacena. How do I say your last name, Jake? With the Kansas City Police Department. I'm sorry.
Bacena.
Bacena, thank you. Thank you. Appreciate it. We are so grateful that you are with us today. We want to hear from you as well. What are you worried about when it comes to COVID and our topic about drugs? Send us your questions on your chat thread via the email. The links to those are right here on your screen. Drug deaths among U.S. adolescents nearly doubled from 2019 to 2020. Researchers say that spike isn't because more teens are using drugs. A study published in the journal JAMA found fewer teens experimented with the drugs during the pandemic. The problem? Increasingly more deadly drugs are trickling into what adolescents are using. What teens may think is an opioid painkiller or a Xanax is now more likely to be a counterfeit tablet containing fentanyl or similar synthetic opioids. The study found that in 2010, 518 adolescents ages 14 to 18 died after using drugs, compared to 954 deaths in 2020. Let's bring in our medical experts. The Drug Enforcement Agency says that one pill could kill. Dr. Sethi, do you agree with that?
I kind of agree with that. The pills that are out there in the market, also popularly called as the M30 pills. M30 literally stands for oxycodone, 30 milligram pills, but they're actually counterfeit pills that contain fentanyl in them. And fentanyl is much, much more potent than morphine or any other opiate. And as a result, for somebody who's never tried anything like an opiate before, does not have the tolerance. And as a result, a little amount of that pill can be very deadly. And adolescents can overdose and they can die.
Share some of the stories that you've been telling us about what you're seeing in your practice, just in general, and get ready to be horrified. This is just so sad. Tell us, share.
So our practice was mostly 19 and above. We are an adult addiction clinic. But then recently, in last 3 or 4 months, we have seen more and more 15 years and above. And so our clinic has actually moved from 19 to accepting patients 15 years and above. That has been a difficult challenge because some of these adolescents have used these pills only once or twice. And these pills are so addictive that they come to our clinic and they are part of our clinic. In last few months of accepting younger and younger patients, we have about 15 to 20 patients already in our clinic who are in their adolescent years and who have tried these pills on the street. And most of them have become our patients through the hospital. They had come in with an overdose in the hospital, and that's how we accepted them into our practice.
Dr. Mitchell, Dr. Douglas, sorry. That's what happens when you have two first
names. Two
right,
last names.
Right, and it's Monday, and I did get my coffee, but just barely before I started. Dr. Douglas, tell us about in your practice. You do outpatient, Dr. Sethi, and you are dealing with inpatient cases. Talk to us about that.
I mean, so what we're really seeing over the over the past year to 2 years, from my experience, increasing number of kids are coming in, dual diagnosis. They're dealing with depression, they're dealing with anxiety, to the point they're having suicidal thoughts, and it's made worse by their addiction to what we're seeing a lot now. It's the opiates. It's the it's the Perk 30s, the M30s. It is forms of an opiate medication with fentanyl. and it's shocking how quickly the kids tell me how quickly they become addicted. It's not a couple days and the feelings and cravings go away. A week into hospitalization, they still recognize they're addicted, and they have lots and lots of problems trying to figure out a way to stay sober. And that's where we're really grateful that Dr. Sethi in the clinic is really able to reach out and help us take care of these kind of complicated kids who are dealing with both a substance abuse problem as well as psychiatric issues, including depression.
Do they want to get off the
Oftentimes
drugs?
they do, and it's just hard. So this is not necessarily a case of they just want to do drugs. This can be a case of they want to get sober, but they don't know how because it's just so hard. Their brain's been fundamentally altered by this medication, by these illicit drugs that they're taking, that they need specialized medical care.
Addiction is hard enough to get over on its own. When the drugs are so toxic,
And so quickly toxic.
that makes a difference. Can you explain that to us?
I think the big reason we've really been pushing this message to the community is that the drugs that we're talking about now are different than the drugs from 10 years ago or 20 years ago. So we're really trying to make sure that parents are saying that message to their kids, especially with the start of the school. Hey, school is starting, that's great. If you are thinking about or you're seeing drugs in the hallway or being offered to you, that is absolutely not something you need to be doing or thinking about. Please tell someone and don't take those pills. It's a different ball game now than 10, 20 years ago.
And I want to talk to you before we leave today about how the next couple of months as kids go back to school under normal years.
Yes.
Or maybe this is our new normal, but in previous years, how that's stressful to them. But first, let's bring in Dr. Sergeant Bakina. Does this all sound too familiar to you? What are your stories that you have to share?
Yes, absolutely. We just completed a town hall meeting alongside the DEA 2 weeks ago called Operation Engage. We were one of 11 host site locations for an Operation Engage nationwide. And this awareness and this challenge of these fake pills that are being manufactured across the country is something that our drug investigators alongside the DEA are spending a lot of time dealing with and finding some really unfortunate cases.
So how did the officers, what do they do encountering this on the street? We heard Dr. Douglas talk about telling children and teens, don't take them, don't accept them. I'm kind of curious where they're getting them.
Yeah, so they are manufactured under uncontrolled circumstances. So they're in people's homes, garages, sheds, wherever you can think of. The fentanyl is typically manufactured outside the United States and then brought into the country. Our interdiction detectives will find upwards of 1 kilo of fentanyl sometimes being transported across the country. And I wrote down some of the numbers. From 1 kilo of fentanyl, which is about a 6 to 9% strength, you can make upwards of 500,000 fake pills. And these pills look very similar to what you would get at the pharmacy, which is why it's so challenging and also so concerning.
So how do you distinguish between overdose and drug poisoning? We've heard you talk about this because I think that, I know I've been using it perhaps incorrectly because I always say overdose.
Yeah, so that's something we're kind of learning as we have more and more of these cases. At our town hall meeting at Operation Engage, we heard from a woman whose son unfortunately died from a fentanyl poisoning from a fake pill. And the logic and the reasoning behind that is an overdose may be either accidental or on purpose, the taking of a substance too much. Whereas the way that they categorize, if you are taking a pill that you believe to be an oxycodone or a Percocet or whatever it might be, but there is a lethal dose of fentanyl inside, then it wasn't your intention to take a lethal dose. So it's more considered to be a poisoning. And that is now the more common way of referring to a drug death from a fake pill is by poisoning.
So you may have answered this, but I'm going to ask you again. What are officers focused on to help stop this challenge?
Yeah, our drug investigators, they are focused on the major players in these type of investigations, the ones that are bringing the fentanyl into the towns and the cities, and not the personal use level, but they are focused on those that are dealing these in the hundreds or thousands or tens of thousands. They have successfully conducted investigations involving tens or even hundreds of thousands of these fake pills. And so they are really trying to work alongside the DEA at interdicting and shutting down these major traffickers of these fake pills and these illegally manufactured pills. And I want to say why that's important. I heard you say going back to school now, urging parents to talk to kids about speaking up. If there is a kid who is concerned about one pill getting them involved in, in trouble with the police or, getting a prison sentence or something like that, that's really not the style that our drug investigators are taking with these. We would much rather somebody speak up, talk out about someone who is involved in selling these fake pills or someone that has them. We have several different avenues. If someone would like to report these, we have a link on our website at kcpd.org. They can go there and search for report a drug issue, or if they just search for drug, it'll take them right to that. They're also able to take anonymous notifications on our TIPS hotline at 474-TIPS, or they have an app at the Crime Stoppers website. They have an app you can work through as well to report these types of things anonymously. Parents talking to kids about this, about not taking something that is not manufactured and sold through a regular pharmacy, is really key to keeping kids safe in these type of situations.
All right, thank you. I think we're going to go to Alexis Del Cid because I do believe we have some questions from the community. She's joining us. Good morning, Alexis.
Morning. We have so many questions coming in from parents who are asking questions that I know I have, I'm sure a lot of you have. So I want to start with Mike, who writes, I wouldn't know the first thing about how to get a street drug. What do parents need to know about how their kids are actually accessing these drugs? I know Sergeant Bakina talked about where these drugs are being manufactured, but I think Mike wants to know, how are these dealers actually finding the kids and how are they making contact?
Number one, overall, above and beyond, is social media. They will order these pills via social media, and the connections do not have to be very deep. Everybody in every school knows somebody that you can hit up on social media and order some fake pills.
So then Jennifer
Wait,
Polo.
Hold on, Alexis, I think.
That's why I think Sergeant Bakina made a very good point, though. This is not certain schools, certain districts, certain areas. This is KC Metro. This is rural. This is Exburg. This is suburb. This is the city. Kansas side, Missouri side. So we're not, I don't think KCPD is talking about a targeted intervention for a certain area. If we're having this discussion right now because this is a problem throughout the country and specifically a problem that we're trying to address here in the Kansas City area. So I just really want to make sure, they get that strong message. This isn't happening at my school. This isn't happening at my junior high. It is. It's there. And so I just want to make sure we really articulate that.
And Dr. Sethi, you were talking about that, how your practice has changed pre-pandemic to now. Explain a little bit about that and the focus on all these drugs. And one drug in particular.
So pre-pandemic, or a couple of years ago, we saw more heroin, black tar heroin, other things. But with the pandemic coming, we went more towards telehealth. And in the telehealth, we actually had these, Zoom sessions with the patients. And some of our patients brought in those pills in the Zoom session and showed it to us. And these looked white or blue. There was no specific color to them. They would break it for us and show it to us. That's in the middle of the pill. They find these specks which are different color, and that means fentanyl to them. So we started realizing there was a growth of these M30 pills, as to what they called. And over this time of last 2 years, every patient, literally every patient that we admit to our clinic, they talk about the M30 pills. And that's the most available pill on the market. And that is easily available, readily available. People have access to it. and then they talk about how they teach other people on how to use it. Now, a youngster might not know how to use it and might take the whole pill. Some of our other people who are grown-ups will tell us how they break it and they use it and they keep safe, but then we give Narcan to all our patients, or naloxone, I should say, to all our patients, which is a life-saving medication. Everybody, every household should have it just in case a neighbor needs it or somebody else in the community needs it, because it is life-saving at the end of the day. So from a more heroin-based practice, we have actually moved to a more M30 or these fake or illicit fentanyl pill practice that we see now.
I see the sergeant nodding his head yes. Is that what you're seeing as well?
Absolutely. A couple months ago, we received a couple pictures from our drug interdiction unit, and we put it on our social media. And one of them was a real M30 pill, a blue pill, and one of them was a fake. And we kind of put it out there for a couple of days to see who could identify the real one and the fake one, just as kind of a challenge. And we got a lot of engagement that way. And there were half the people all thought they were right. So it was really kind of interesting. So there were some very convinced people that thought the fake one was real and the real one was fake. And that just goes to show you how hard it is to identify if you're looking at these in a baggie or in just a generic pill container or something that is uncontrolled, not directly from the pharmacy, just how hard it is to identify these pills.
And one thing families can do, and certainly doesn't solve the problem of access to illicit drugs via social media, if there are prescribed addictive substances in the house that are not being used, they need to be thrown away. So you had the shoulder surgery and you have some sort of oxy whatever and it's left over, don't have it sitting in a bottle in your cabinet. If you have kids in the house, that makes it more available. It can lead to the process of addiction and then subsequent to the use of these highly more addictive drugs. If you take a pill that's been prescribed and you no longer need it, figure out a way for it to be disposed of. You don't want it sitting in your house.
Right.
I can add in real quick on that. Twice a year, the KCPD does a drug take-back event with the DEA. We have about 12 or 15 locations across the city over that weekend where you can, no questions asked, bring your unused prescriptions and have them safely disposed of. And then year-round at our North Patrol Division and our Shoal Creek Patrol Division, we accept them any time of day. There's a receptacle in the lobby, and you can safely bring them in there, no questions asked, and they'll be properly disposed of.
We also have a safe medication drop-off here at the health system too, in the pharmacy. So you can just drop it off, no questions asked, same thing. So, Alexis, more questions?
Many more questions. Our experts have answered Ruth Allen's question, which was, what's the best way to get rid of prescription pain medications? But I wanted to ask this. Everyone's advised to not flush your prescriptions, rather throw them out if you're going to do that, right?
Dr.
Yes.
Yes. We tell our patients not to flush those medications. They get into the soil, that's actually going into the water, and that's not a safe mode of disposing them off. But if you have those extra pills, like Dr. Douglas said, we should dispose them, we should give them away, because those are very unsafe. If they're lying in their closet, somebody will have access to them, and that is a potential for overdose for a youngster who doesn't know what they're taking.
Cindy has a question. She would like to know what role that you believe the pandemic played in trafficking and abusing fake prescriptions.
I'll start with the sergeant. Yeah.
During the full shutdown and then later times when more people were at home, not going to work, I think it definitely played a role in the spreading of the dealing of it across social media. People out of necessity had to go to those avenues and those mediums to interact with somebody who was willing to sell them an illegal fake pill. And it showed them, I think, that it's easier and just more simple to do that rather than, a more street level dealing on a regular basis.
And how about you?
Very similar. I mean, I think I'm going to sort of segue the question just a little bit. In addition to, obviously, we're focusing right now on opiate addiction and especially opiates with fentanyl and M30s. Also, from our experience in the hospital, seeing a significant increase in use of marijuana and really high concentration marijuana. The number of cases I've seen recently of basically first break psychosis or ongoing psychosis exacerbated by really high potency marijuana use has been extraordinary. So we're focusing right now talking about opiates. We want to make sure we send the message like there are other things out there as well.
Dr. Sethi?
Yes, and if you have any controlled substance at home, you want to make sure that you have access to naloxone for sure. You make sure that the kids are aware, the kids know what the dangers of these medications are, and also the potential of getting it from the street is going to be much, much more dangerous because we do not know the potency of these drugs. Having that conversation with the kiddos is going to be super, super helpful because it just brings in education. I always talk about education. Educating the kids is the key to stopping this pandemic.
Alexis, we're going to, since we brought in the pandemic, I think we're going to go over here to Dr. Hawkinson and get our count in, and we'll be back to you because I think you have some probably COVID questions today as well. What are our numbers? How did we do over the weekend?
Yeah, I mean, we're still holding steady, just under 30 in those high 20s for active infections. Right now we have 27 active infections, with 3 in the ICU and 1 on the ventilator, still 23 in that recovery period. The active infections, the really number has plateaued and has continued to be quite consistent for the past few weeks.
So I have a couple of headlines here. The recommendation, if you're returning from being out with COVID, is to wear your mask continuously here at the office for another 5 days per the CDC guidelines. But then this JAMA study came out, and it makes me wonder if people can still be contagious after 5 days.
Yeah, I mean, we know that. We have known that. You know, some of those recommendations that were made because to get people back into the workforce. But again, they do stress wearing the mask as well. So this new JAMA study, it is a small study. It's really not new. Earliest studies from the pandemic really showed that after really about 8 days, you weren't able to culture live or infectious replication competent virus. And so I think, you know, using that more 7 to 8 day period, even up to 10-day period, you're really going to not be infectious after that time point. But really, if you are doing the 5 days of isolation per CDC guidelines, they do say after that 5 days, still go wear a mask. At that point in time, your viral load is certainly decreasing. We know the highest viral load really in your upper respiratory tract is especially that 1 to 2 days prior to symptoms, to about 2 to 3 days after symptoms start.
The Washington Post reported that Dr. Fauci is sending a warning this weekend saying, quote, trouble is ahead for those with the BA.5 variant if not up to date on vaccines. Why is he saying that?
Yeah, I mean, I think he's saying that because what we know and our best data support the fact that those people that are in the hospital, those people that are dying, again, we get these questions all the time, who's in the hospital, why are we still having deaths? Those people, number one, have risk factors such as age, comorbidities, but also are either not finished with a full primary series or are not up to date with any boost. That means that first booster, or if you fall into that criteria, that second booster as well. And so that's vitally important to remain up to date.
Should people go and get another booster if they've had?
You know, that's a question that it's getting harder to answer as we're getting closer to September. I know that they were expecting to have the rollout of the vaccine in that early to mid-September. Certainly, we would always endorse the fact of if you're in that category of getting that second booster dose, which is 50 and over, you should get it. But we know that the other or newest recommended vaccines are going to be out soon. So we're kind of in that gray area. Really just judge your risk factors. Again, it's also vitally important to get tested early and get on Paxlovid if the test is positive, especially if you are not up to date with your boosters.
Okay, so one more headline. This was this article in the Wall Street Journal, and as a mother, and even though my baby is 30, this surprised me. It says that despite having the COVID-19 shots available for children under 5, that only 4 to 5% of kids parents are getting their kids to take the vaccine.
Yeah, I mean, it's certainly sad. It's tragic. We know that kids, although luckily affected less than adults or older age kids, can be affected. And it's important to understand, what if that child was somebody you knew, was in your family, was in your bubble? We know children can be affected by the multisystem inflammatory disorder, can be affected by severe disease, but also long COVID. We know the vaccines do help prevent and reduce the risk of that. And I think this is more of a global issue as far as vaccines. We've heard about the case of polio in New York and the low uptake of vaccine for polio there. It's vitally important for all parents to talk with their pediatricians to get those children vaccinated against all of these vaccine preventable diseases that we haven't had problems with in the United States since a lot of these, especially public school mandates, have been available. We know how they can protect children. We know how they can keep everybody safe. So it's vitally important to do that, whether it's the mumps vaccine, polio vaccine. Now again with COVID as well, I think we need to continue to endorse and spread that message of uptake of the vaccine, getting these children protected.
Well, I've said this before, I always do what you tell me to do.
Yeah.
And have my family follow. And knock on wood, we've been lucky.
Yeah.
We have not gotten COVID yet. Those are my questions. Alexis, I bet our audience has got even better ones.
Jean has a great question for Dr. Hawkinson. Dr. Hawkinson, Jean would like to know if you can tell us anything about the polio cases that have been found around New York, and are we still protected by our old vaccines?
Yeah, you know, I think it was just one. We do know that they were, as they are looking now, they are finding polio, evidence of the polio virus in the sewer system. So I think it is important, you know, this case of polio was from the oral polio vaccine that had kind of changed a little bit. We know that that virus does it. We know that it can cause infection. That's why it is vitally important to be protected with the polio vaccine. Here in the United States, we use the injectable polio vaccine. Yes, you are still going to have protection from polio. You may be infected, but you won't get that disease process, that poliomyelitis that everybody has seen pictures of, or people, you know, back in the past, because since we've had that vaccine campaign, we've done very well with any other acquired polio virus disease. So it is vitally important. It is a significant issue, and especially as we're talking about kids going back to school, so it's important to continue to endorse those childhood vaccines, preventable vaccines, getting those vaccines. But it is an issue. It is still evolving. I know the infection, I think, was in late May or June. Haven't heard any others since that time, but we'll still be monitoring for that.
Janet Coy has a COVID question. Janet wants to know, if someone had COVID a month ago and then was exposed to COVID again, how long should they quarantine for? And do you still have to quarantine after an exposure?
Yeah, I mean, I think a lot of this depends on your up-to-date with vaccines or not. Obviously, if you've had COVID within the last month, I believe the current guidance would suggest just monitor for symptoms. You are not having to quarantine. Obviously, if you get symptoms, test early and then isolate.
Yen Ling has a question, Yen Liang, and this is a dual question. It's about COVID, but also drug abuse. Yen Liang would like to know, are there any connections between drug abuse and trying to mitigate COVID symptoms? Could anyone be abusing drugs to deal with their COVID symptoms? It's interesting.
Well, I'll just give a quick answer and then look to my colleagues over here. I think if you're looking at symptomatic COVID, I would think the things that we have been talking about that are making the impact that we are discussing here, such as the fentanyl, I'm not sure a lot of people are taking those types of things for COVID, but obviously, you know, when you are feeling sick, you want to feel better any way you can, but I'm not aware that there's too much association with those two things at this point in time, but I'll defer to my colleagues.
I mean, I think the question's very astute, though, looking at trying to combine those questions we're talking about, fentanyl addiction as well as the COVID, and looking at the temporal rise at the same time. I would view the connection as the psychosocial impact of COVID on our society, leading to possibly an increase in some aspects of substance abuse. So if the family system is disrupted, if parents are sick, if prior care providers are hospitalized or dying, then that certainly is going to lead to an environment where things are not structured, organized, and well monitored, which can lead to an increase in addiction.
I can just relate a few cases that we have seen in our practice. And we had one patient who had COVID and used more of cannabis or marijuana because it would help him or her sleep. And, it was not a good experience. And that's when the patient came back to the clinic because it actually exacerbated the symptoms, the breathing symptoms. We've also had a couple of patients come in and tell us that they increased the use or relapsed back to use of M30 pills or the fake illicit opioids because they were sick and they were in pain. And ultimately, they had to come back to the clinic to get help because it actually exacerbated the whole picture again. So I don't think it's a good mixture overall because it is not going to help the overall picture.
All right. Alexis, are we good for a minute?
We're okay for a minute, but I got to tell you, the questions about drugs, I've got a lot of questions about Narcan, and several questions for Sergeant Bakina as well, in addition to our doctors. So when you come back to me, we'll have plenty more.
All right, and we will be right back. I just want to talk about this for a second. The pandemic is helping to fuel the public drug crisis. I think our experts have all said and agreed on that. There is a study by STAT, however, that shows other experts are divided on exactly how COVID has fueled this, although they all agree it is connected to supply and demand. Some researchers believe the drug pushers, suffering from supply chain issues like everyone else, accelerated the toxicity of their fake prescription pills. Others believe demand is driven by feelings of disconnection and isolation brought on COVID-19. Mental health experts seem to agree that COVID has worsened mental health issues among everyone, including teenagers. At the same time, treatment programs were interrupted. And I just want to go back to memory lane and try to think back. I remember before we even knew what COVID was, that we were starting to talk a lot about opioid addiction and changing how doctors prescribed opioids, and our patients were trying to get used to that, and then bam, COVID hits, and sometimes you can't even get in to see your doctor. Was that a problem? Did that exacerbate, do you think, any of this?
I think so, because when COVID hit and we went to a lot of telehealth practice at that time, we were having more and more patients who could not access and get their prescription medications, and as a result, they ended up going to the street and getting whatever was available or buying these illicit drugs, and some of them with the M30s. That's when we've heard about more of M30 use, and then they came back to our practice and of course met criteria for being in our practice, and then were treated with life-saving medications like methadone, buprenorphine, Vivitrol, Sublocade. Those are for opioid use disorder, and that made their life better. The addiction treatment centers did not close. Most of them did not close during the pandemic. A lot of them went maybe via telehealth practices. Our University of Kansas Health System Addiction Treatment Center was always open. We always accepted new patients at that time, and that was a time when we actually saw an increase in the use of these M30 pills over the street.
Okay, so I want just for a second for you to explain these tools in the toolbox that you're talking about. You're mentioning these drugs that you have available. Just help us understand just briefly how those drugs work, and tell us their names again.
So there are 3 FDA-approved medications for opioid addiction. One of them is the gold standard treatment, which is called methadone. It has been out since 1974. We have a lot of studies, lot of research, lot of use of this medication. Those can only be obtained from an opioid treatment program. When I say that word specifically, it cannot be prescribed to you. The only way you can get it is if you get to an addiction treatment center, which is an opioid treatment program like ours here. You will be dispensed the medication. So you'll come to the clinic, you will have the medication be given to you in front of the nurse, you will drink the medication, and then you'll go back home. Simple. It's a 5-minute thing, and it's a life-saving medication. It goes and binds to the same receptor where the opiates bind, and it actually kind of activates or ups the receptor, so the patients or the person using it does not have the need or does not have the craving, does not have withdrawal symptoms, the 2 basic reasons why people use these drugs, and that prevents the use of the illicit drugs. It's a harm reduction strategy which really works in the long run because people stop using, helps them get their lives better. their psychosocial life gets better, they attain jobs, families get back together. We've seen a lot of patients with that, and the overall quality of life improves with these patients. They can be in the clinic for as long as they want. We never ask them to go. So we have had patients for like 20 years in our clinic. The second medication is called buprenorphine. Fancy word for it, or the trade name for it, is Suboxone, popularly known as Suboxone. It also acts at the same receptor where opiates or the drugs act. It also, just like methadone, but it only partially increases the effect at that receptor. So that means people typically don't get the high word, as we call, from the medication. It is easier for that medication to be obtained because anybody who has a license to prescribe that medication can actually prescribe it to you. When I say that word, it means that you go to that doctor, the doctor can actually give you a script, you go to the pharmacy, you pick up your medication. Life-saving, because once that medication is bound to those receptors where these drugs were acting, even if you take a drug on top of it, those drugs will not be able to move this medication from there, and it is life-saving. A lot of people then believe, I just wasted my money by using the drug had no effect on me, and then it deters them from using. They do not get sick if they're already on the medication and then use the drug, but it just, because they have no cravings, they have no withdrawal symptoms, they do better, quality of life again improves, and they have better outcomes with this medication. The third medication that we have out there that has been there for a while, since 2010, is called Vivitrol. It's a once-a-month injection of naltrexone. It's given intramuscularly in the muscles. And it is easier because once you are on that, all you have to do is get to the clinic, get your once-a-month injection, and you're good for a month. Even if somebody who does not have the insight or does not know and ends up using an opiate or any opioid drug on top of it, it doesn't work because this medication is again very tightly bound to the receptor and will not let the drugs act. So all three medications are life-saving. Different people will need different medications based on your availability, your family situation, but they are life-saving and they can get you back into your normal way of living.
And you help navigate the insurance, or
Yes.
sometimes there has been grant money in the
Yes.
past.
Yes.
So
Yes.
they help with all of that.
Yes.
If you're worried. And inpatient tools in the toolbox, what's different?
In terms of substance abuse, in terms of life in general in my inpatient world?
Well, I think we're talking substance abuse
Yes.
first.
So what we're seeing at Marillac, we are an inpatient psychiatric hospital. We are not a primary detox facility. So if there's a younger person who needs primary detox and is in a life-threatening, have life-endangering withdrawal symptoms, then that's going to be best served in a pediatric population. But we see lots and lots of kids who are coming in dealing with both substance abuse issues as well as their primary psychiatric issues. And we are really engaged in expanding our knowledge base and our services, including having consultation services with Dr. Sethi for the age-appropriate population, to help us provide a really great evidence-based medical care for these addiction problems. And this includes how we're addressing opiate issues with opiates, issues regarding marijuana, and other substances.
Sergeant Bakina, there was another study that said, just published recently, that a quarter of fentanyl seizures by law enforcement are now in pill form. And we read that teens prefer pills over powder. Do you agree with this? And
Yes, absolutely.
Sounds like that's more dangerous.
Yes, absolutely. At least, I mean, in the powder form, you know that it is fentanyl and it is present. In these uncontrolled pills, there may be a lethal dose of fentanyl in part of the pill and none in the other. We have seen instances of youth, they will share a pill, like cut a pill in half and share it. And one person has very little effect and another person has potentially a lethal effect. The other thing is that what our drug investigators have seen alongside of the DEA is that as many as 4 in 10 of the pills that they seize contain a lethal dose of fentanyl. So it's very, very dangerous.
Wow. This is a very scary talk today. Let's hear what the community has to say. Let's go back to Alexis. And Alexis, what questions do we have as we wrap up our talk today?
Jay wants to know if just touching one of these pills can kill you.
Well, I'm going to go with the law enforcement officer first because you have probably more direct contact in that way. I hope our doctors are not touching the pills, so maybe you would know.
Yeah, our officers are instructed to take, all barrier precautions with gloves. And our drug investigators have additional precautionary measures that they take. There are instances that people have, touched an amount of fentanyl and gotten sick from it. We have heard of instances across the country. I would defer to the medical experts as far as the toxicity and exactly on that. But I do know that whenever we encounter something that could potentially have any powder or any fentanyl associated with it, we take all the barrier precautions that we have available.
Yeah, I guess it's smart.
Barrier precautions, I mean wearing gloves.
Gloves.
Correct.
Yeah.
Yeah.
And we do the same in the clinic. We sometimes, when we initiate buprenorphine on patients, we tend to wear gloves because if you have a nick on your skin or even through the direct skin contact, if you end up touching the medication and you've never done anything like an opiate before, you are not tolerant, as I say, so you are not used to that medication, and that small dose can also can be pretty life-threatening for you.
So bottom line is, we don't know what we're dealing with. We do know that it's dangerous and everybody reacts differently. Yeah. Alexis?
I'm getting a lot of Narcan questions.
Sure.
And I know this is a huge topic. I know I've talked to Dr. Sethi about Narcan quite a bit. Vicky wants to know, how does the average person get a hold of Narcan to have it available?
So I can talk about University of Kansas Health System. We actually have an automated thing in our pharmacy now. If I'm prescribing any controlled substance, for instance, so I'm going to give you the example of buprenorphine. Every time I put a prescription in, I am actually asked by the system to put a Narcan prescription in. Similarly for benzodiazepines, if I am prescribing a benzodiazepine like Xanax or alprazolam or clonazepam, it automatically asks me to put a prescription for that Narcan. I tell the patients, this is a life-saving medication. You can keep it at home. We know you are not using, but if there's a family member or a friend or a neighbor you find unconscious, this medication could be life-saving for you guys. And we tell them how to use it. So it's a pretty good access to the medication. Also, our addiction treatment center will have grant funding that for our patients, we can give them a free supply as well. And a lot of other states and other centers will have that same funding as well to get that medication. But any doctor that you go to, if you are on a controlled substance, you can always ask them for a prescription of naloxone.
And
So-
I just want to iterate, the American Academy of Pediatrics and multiple professional societies are all pro prescription of Narcan. It is not considered a unusual thing to ask for. Everyone is aware of the opiate problem that's happening throughout this country. Requesting that you have a Narcan prescription in your home due to the presence of opiates, which may not be prescribed to you, but might be for another family member. I would hope that the response would generally be positive and appreciative that you're doing everything you can to keep you and your family safe.
Would you consider it akin to having an EpiPen on hand?
Dr. Seth?
An EpiPen. She said, is it similar?
Yeah,
and
Yes.
is it would-
Oh, sorry. Yes, it's kind of like that. You have naloxone. It's used, most of the ones that we prescribe are used nasally, so inside the nose. But yes, we tell the patients to put it at some place where all the family members know where is it lying. And if you have somebody who passed out in the house, try this first while you're calling 911. This could be life-saving for you. Yes, absolutely.
So then Isaac Presley has an interesting question. He says he's seen a lot of comments on social media from people who oppose distributing Narcan on the grounds that they believe it will encourage more drug use. As three experts on this topic, have you seen any studies that indicate that or disprove that it would encourage more drug use, having Narcan on hand?
I can go first.
Please, yeah.
I don't know about the studies. I haven't seen any studies like that, but it is a life-saving medication. Just as we don't know what is out there in the market, what our kiddos are getting exposed to, it would be worthwhile to have this life-saving medication in the home and keeping it with you, specifically if any controlled substances are in the house. And so it could be pretty life-saving. I would just go with it.
And I'm going to reiterate the comments from Dr. Thornton, one of the medical toxicologists here at KU Health System, who is unequivocally, one of the most qualified persons in the state regarding this topic, Unequivocally, Narcan saves lives. It does not promote substance abuse. It helps. It takes a child. It takes a person who is in a state of being. I mean, let's be blunt. They could be dead and now they're alive. I don't understand this question. I mean, Narcan saves lives.
All right, Alexis.
I am getting, and I'll just paraphrase this because I'm seeing about 10 different questions, all relatively, they're asking it in different ways. But a common question I'm getting that I'm seeing online is, do each of you have specific words or phrases that you recommend we use when talking to our kids about this? Parents are wanting to know what concrete things can they do or can they say to reach their kids, to impress upon them how high these stakes are and how dangerous this is.
I think that's an excellent question because words matter, and I can't even imagine, especially at different ages with kids, they don't care what mom and dad are saying.
Right.
So, as dealing with,
yeah, and this is the tough one. This is where the kind of the rubber meets the road. I would look at that conversation being in two parts. So before you just start with, "Let me tell you about these drugs. They're really bad. Don't do them."
Right.
Maybe start with some questions. What do you know about this? What have your experiences been? No judgment. What are you seeing in your school? And engaging them in a dialogue. If they're starting to think and engage in a dialogue, this is what I've seen, what I've heard, and then you present them information, is going to be a more successful conversation. If you just go in hard with, I saw this morning report, doctors say don't do drugs. Good, better to do that than nothing at all, but even better to have an actually engaged conversation with the person in your family.
ask questions.
I actually reiterate what you just said, but yes, having a more gentler conversation, an open-ended conversation with the kiddos and just telling them about what is out there and how dangerous it is, and that not passing a judgment. I think that's the best stance. A non-judgmental, open-ended style is what we use all the time, and that really helps with the youngsters as well.
All right, Alexis.
One of our viewers wants to know if Narcan is available with law enforcement and in hospitals and in homes. Is it ever going to be, or is it now available in our public schools?
I don't work for the public school system, I work for KU Health System. I'm under the impression that in almost all school districts in the KC metro area, Narcan is present. I believe at least in the high school level. Sergeant,
do you know?
I don't, actually. That's actually a really good question. I wouldn't want to speak out of turn about a school district policy. I wouldn't be surprised if it was available, at least with the school nurses or the clinics within the school. It wouldn't surprise me a bit if it was available there.
I think I should probably pull my words back. I don't work for the school districts, don't know about the school district policy. I am aware that multiple school districts do have Narcan available, though.
Right.
Okay, that's interesting. Jennifer Polo would like to know, what do you think about CBD oil instead of opioids and other painkillers? I think she's asking if it's safer or more effective. I'm not sure what comparison she's asking you. But,
yeah. CBD oil?
Well, it's a difficult topic to talk about because we don't know what the source of the CBD oil is. Does it have any THC, which is the thing that they take out from CBD oil in it, and what is the source that you're getting it from? If you're talking about a youngster, I tell them that till about 24 years of age, your brain is still developing, especially the frontal part of the brain, and a use of any kind of marijuana or anything containing THC would actually alter the brain development. So specifically for our kiddos, I specifically tell them not to use any illicit substance.
Anything to add, Sergeant or Dr. Douglas? Nope. All right, go ahead, Alexis.
Will Findley has a question, and I'm curious if either any of our three experts have these stats on hand. What state is first in drug deaths, and where does Missouri fall when it comes to drug deaths? And then I'll follow up with, if you know Missouri, do you know where Kansas falls?
All right, who wants to go first?
I don't have the exact numbers memorized.
Neither me. Sorry, I don't want to speak.
I will tell you, back in my days of doing reporting, that Missouri and California, when it was methamphetamine, used to kind of trade off. Mm-hmm. But I don't know where we are. And you don't know, Sergeant, either, where we rank?
I do not. I'm quickly typing into Google here to see if
Okay, well, we may have an answer to that. Do you have another question?
But that's it. I mean, this just to piggyback on what Sergeant Bakina and both our doctors have said is that this doesn't know any boundaries. It's not like, from what our experts are saying, this is happening in one neighborhood or another neighborhood. So it can happen anywhere. If you're watching this, it could affect your child.
And I'm saying that from the perspective of an inpatient medical director of an inpatient psych hospital. In our catchment area, the area that where we take our patients come from, it's broad. I mean, it's through western Kansas to central Missouri. And I have known cases in all the regions. It's not a specific area that we're just seeing stuff come from.
Let's just do a couple of more questions as we're running up on time.
I know. You'll have to cut me off, Jill, because these questions are going to keep coming. So Isaac has a very good question. It's interesting. It's for Sergeant Bakina. Isaac writes, when I was in elementary school in the early 2000s, I remember the DARE officer would sometimes come along to our school. Then I read later that the DARE program wasn't as effective as deterring drug abuse as police had hoped. So what do you think based on your experience?
We still have the DARE program, and we still run across adults in our city that remember their DARE officer and remember the impact on it. Whether one study or another may show effectiveness or statistical effectiveness, we believe that engaging with kids and talking to them about drug use is a positive thing. And even if it helps one kid that wouldn't have been helped before, then it's worth it to do it. It's something we're going to continue to do.
To follow up on last thing that I have a question of, Sergeant, is that I thought this was really powerful. And if anyone's just tuning in, when you talked about how you're not out there to arrest one kid for having one pill, your goal is to save lives. Can you reiterate that again if there's any teenagers who are afraid to come forward?
Yeah, our drug investigators are focusing on major players in these type of investigations. They're focusing on the people that are bringing kilos of fentanyl into these communities and the people that are using that to manufacture hundreds of thousands of pills and then distribute them. If there's a student or if there's someone, a young person that knows of someone dealing with these pills or knows of someone that has them and can potentially stop something that could kill somebody by speaking up, we are encouraging that.
All right. Alexis, thank you for helping out this morning. I truly appreciate it. Sergeant Bakina, I'm going to give you the first opportunity for a final thought. Send us off today. What would you like us to know?
I just want to thank you guys for having us on behalf of KCPD and all of the great work that our narcotics investigators do. They are out there every day working very, very hard to make sure that people are safe from these type of drugs and these type of situations. And the more people talk about it and the more people make it part of mainstream conversation, like what you guys are doing here, the better chance we have to combat this. So I just want to thank all of you guys for making this a topic that is on people's minds.
Thank you, and thank you for joining us this morning. Dr. Sethi, final thought.
I'd just like to say to all the parents, if you have a child that does not look okay or is not acting the way he was or she was in the past and you're worried, go talk to your pediatrician. Or if you have a child who's struggling with any kind of opioid addiction that you've already found, there's help. There are medications, and it is okay for them to be on medications and get the treatment and then get into recovery and do better with their lives.
All right. Thank you for being on as well. And Dr. Douglas, I'm going to have you back because we have to talk about things that we worry about going into school. And you have a new program that's getting ready to start.
Exactly. So many good things to be talking about in the future, and a little bit more of maybe a positive conversation.
Yes. But final thought?
Final thought, I'm kind of what's being said here is good that we're having this conversation. And just as we're going to have this conversation, then we're going to extend this conversation to the younger people in our lives to make sure that they're aware it's okay to talk about, and make sure we're really specific and let them know this is why we're worried. Because we can give you really specific, and sometimes with young people, giving them a really specific example. Hey, you know what? They took one pill and they died. That's why we're having this conversation. And making it very specific and tangible can really help that message get through. That said, school's starting. We're going to be going to school. Kids are going. There's going to be football games. There's going to be activities. There's going to be theater. this is exciting too.
Yeah,
Let's get
it
to school.
is. It is great. Dr. Hawkinson, what can you add to that?
Not much. I mean, I think he said it just great. You know, this is a significant issue. It can affect everybody, every household. It's important to continue to have those hard conversations and have that communication with the young people to keep them safe.
All right. Thanks to all of our guests, and thank you to you watching at home. If you don't show up, there's no reason for us to, so we really appreciate you. Coming up tomorrow, we'll revisit the story of a man who's made several appearances on the Morning Medical Update. You may recall Anil Garmalkar, a truck driver who caught COVID early in the pandemic and has suffered many long-haul symptoms since. We will recount his most recent visit in a special encore episode. We'll be back live Wednesday for Open Mics with Dr. Stites at 8 a.m. Make it a great day.
Nature is filled with beauty and snakes too. I'm Jessica Lovell. 5 million people worldwide are bitten each year. How you can protect yourself, plus why the next catfish you catch could pose a danger. Wednesday at 8 on Open Mics with Dr. Stites.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.